So I would like to show you on someone of you craniosacral rhythm. So I will ask someone to lie on the table, and we will start from the heel. So I will remind you that the craniosacral rhythm is external rotation, is flexion, and internal rotation is extension. So on the body you can feel only this movement, external rotation and internal rotation. Řitko, můžu tě poprosit, aby si na stůl. A nožičku ještě se posunout na. Dobře. To pohodlně? So the first position for listening craniosacral movement or rhythm is under the heel. And for me, like a therapist or practitioner, this position must be very comfortable. So I'm sitting very straight, my feet are on the ground, and I'm trying to feel craniosacral rhythm. What is also very important, you palpate the rhythm only 5 grams of pressure. So I will show you on the feet. You can feel external rotation, then the rhythm stops, and internal rotation. And you can feel the break afterwards too. So first position is under the heels. Then it's better to stand up, and second position is over the feet. So in this position I palpate craniosacral rhythm in 5 grams, and it's also very good to touch the client or patient normally, and then you can reduce your pressure. You can let go of the pressure of 5 grams. The other position is above the thighs. It's also good for you to let your fingers to look up, so don't change the position in transversal direction. So this is the third position, and you feel the same, external and internal rotation. The fourth position is around spina iliaca anterior superior, which you can see and also you can feel. So the position of your hands is the same. And don't expect very big movement, because pelvis is very structural component. And the fifth position is around the ribs. And here you can feel the breathing, so it can be a little bit confusing for you, so you can ask somebody on the table to stop the breathing for a while, if you want. But it needs a time to feel craniosacral rhythm here. And also try to feel the symmetry on left and right side. Try to feel the amplitude and the rate of craniosacral rhythm. And everything you palpate of 5 grams of pressure. And the other position will be around the shoulder and on the head. Tak, tě poprosím, jestli by si změnila polohu. So other position of listening craniosacral rhythm are the shoulders. So you put your hands around the shoulder, left and right. You palpate craniosacral rhythm of 5 grams of pressure. and you try to feel external and internal rotation. You try to feel symmetry, left and right side. You try to feel the amplitude of flexion and extension, and you can get also imagination of the rate of craniosacral rhythm. How fast is the rhythm? How fast is the rhythm? And then we will apply the rhythm on the head. So the first position is that your second finger is going on the sphenoid. So first of all, you need to find the sphenoid, which is like continuing of the eyebrow, and it's a small hole between the bones. And please be careful, you don't have to be on the orbit. So orbit is the different bones, so you must be under it. So first you need to be in touch in sphenoid, and then you will try that your little finger is in contact with occiput. So the main contact is in the second finger and little finger, and your thumbs, third and fourth finger are not in contact with the head, or it's not important to feel the movement of the head. And now you are trying to be focused on the medial lateral movements. So if the head is in flexion, you feel how the head is widening. And if the head is in extension, you feel the narrowing of the head. So my position is like that, and you can feel flexion, extension, flexion, extension. The second position is evaluate craniosacral rhythm in antero-posterior direction. So my posterior hand is in contact with occiput. It must be very comfortable for the client. And the second position, or the second hand is going, it should go on the sphenoid, but my hands is not so big. So better for you will be contact with frontal bone. And my pressure is 5 grams. So very little pressure, small pressure. And you try to follow the rhythm in flexion and extension. So narrowing means flexion, and widening means extension. It's the opposite movement than the first evaluation. So you can feel like your hands are going towards each other. It means flexion, narrowing, and widening means extension. And the third position is that your thumb are in contact with the sphenoid, and your fourth, fifth finger is in contact with occiput. And now you are trying to feel the superior, inferior movement of craniosacral rhythm. So you are in contact, or you feel more sphenoid, which means if you feel movement towards the feet is flexion, and movement towards the head, or to me, like a therapist, is extension. Also, you can feel some movement on the occiput, but please don't follow this movement because it's disturbing for you at this moment. And also the placement of your finger must be very comfortable. Only 5 grams.